What are flu symptoms in children versus other illnesses? Imagine your child suddenly feeling very sick and you wonder if it's the flu or just a cold. Flu symptoms in children often come on quickly and can be quite intense. They usually have a high fever that can go over 39.5 degrees Celsius, chills, a headache, and muscle aches. Children with the flu often feel extremely tired and want to rest in bed. They might also lose their appetite and seem very unwell. The fever and muscle aches typically last 2 to 4 days, but cough and tiredness can stick around for a week or more. Some children may even have symptoms lasting up to 3 weeks. The way flu shows up in children depends on their age. Babies and newborns might only have a high fever that doesn't seem to have a clear cause, with no other obvious signs. Young children often develop a fever over 39.5 degrees Celsius and may experience febrile seizures, which are convulsions caused by high fever. Kids under 2 are more likely to have stomach symptoms like vomiting, diarrhea, or stomach pain. Earaches and red eyes are also common in young children. Sometimes, severe leg or back pain can happen if muscles swell. Overall, flu can be more serious in children under 2 and those with certain chronic health conditions. Now, it's important to tell the difference between the flu and other illnesses. The common cold is much milder and develops gradually. Children usually get about 6 colds a year, caused by over 200 different viruses, mainly rhinoviruses. Cold symptoms often include a runny nose, sneezing, and a low-grade fever. Fever in a cold is usually mild or absent, and children rarely experience severe muscle aches or chills. Cold symptoms tend to last 3 to 10 days. In contrast, flu symptoms come on suddenly and hit hard with high fever, headache, muscle aches, and fatigue. The flu can make children feel very sick very quickly. Distinguishing between the flu and COVID-19 can be tricky because they share many symptoms. Flu symptoms tend to appear suddenly with high fever and body aches, while COVID-19 may also cause loss of taste or smell and can have a wider range of severity. COVID-19 symptoms often last 1 to 2 weeks, but some children may experience symptoms longer. The only way to know for sure if a child has COVID-19 is through testing, as symptoms can overlap and vary widely. Respiratory syncytial virus, or RSV, is another virus that can cause symptoms similar to the flu. It often affects young children and can cause cold-like symptoms, sometimes more severe in infants. Both flu and RSV can lead to complications like pneumonia or bronchiolitis, especially in very young children or those with health issues. Most children recover from the flu without serious problems, but complications can happen. The flu can cause infections like croup, pneumonia, or bronchiolitis. In rare cases, it might affect the brain, leading to seizures or confusion or impact the heart. Flu can also weaken the immune system, making bacterial infections more likely. Serious complications include inflammation of the heart, brain, or muscles, and, in severe cases, multi-organ failure. Every year, around 20,000 children under 5 are hospitalized because of flu complications, and sadly, some children die from the flu, especially if they are not vaccinated or have underlying health conditions. Vaccination plays a key role in protecting children. Children under 8 who haven't been vaccinated before may need 2 doses of the flu vaccine to be fully protected. For infants younger than 6 months who cannot get vaccinated, creating a cocoon of immunity by vaccinating everyone around them is very important. This helps reduce their risk of catching the flu. Always consult healthcare professionals for personalized advice and to determine the best protection for your child. Remember, understanding the differences in symptoms can help you seek timely medical care and keep your child safe.